Atlanta Care's new affiliation with the nationally top-ranked Cleveland Clinic Cancer Institute helps to advance cancer care locally. We discuss this and more on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by Atlanticare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Atlanticare's new affiliation with the Cleveland Clinic Cancer Institute helps to elevate cancer care here locally. We welcome Dr. James Worser. He is the medical director for the Atlanticare Cancer Care Institute. Dr. Worser, welcome to Latino Motion.
Thank you, Bert. Good to be here.
And this is not the first time you were on Latino Motion,
That's
so
right.
We're certainly happy to have you back.
Thank you.
Let's talk about the affiliation with the Clinic Cancer Center. I know that the clinic is number 6 in terms of ranking nationally, so it's a top-rated institution. Tell me more about that.
Sure. I mean, this is a really exciting time for us. Cleveland Clinic is a world-renowned hospital and top-ranked cancer center. And I had the opportunity to fly out and visit, and it is a really incredible institution from top to bottom. What this allows Atlanticare to do is really raise the bar in the community. We already had a fantastic cancer center. But what this does is allow us to have access to world-renowned physicians, second opinions. We can have teleconsults for our patients. It gives us access to really cutting-edge clinical trials, as well as many of the standard operating procedures for their cancer center. These are protocols. These are algorithms and pathways that their physicians have developed in terms of treating cancer.
So let me ask you in terms of cancer treatment, there's always trials taking place. And how significant is it to be associated with Cleveland Clinic in terms of those type of opportunities for patients here locally?
Well, you know, the only way we really advance in medicine is to research better ways to treat patients. Having access to these protocols is both important as we move forward in the field of medicine, but it also is giving many of our patients a cutting edge. If there's a new technology or treatment out there, we're going to be able to give that to our patients. They'll have access to that. They won't have to travel out of the area. They can do it right in their, the comfort of their own town.
Yeah, I want to focus a little bit on that because I remember in the past, even just to get a screening, folks had to go over the bridge to Philadelphia. And certainly just having a renowned affiliation like the Cleveland Clinic does help to put people at ease. So yeah, you could come here locally to Atlanticare and get that high level of treatment.
Absolutely. And I do want to reiterate, our cancer center is already incredible. When you look at a program, at the components of it, from the program itself being certified by the American College of Radiology, the Commission on Cancer. We already have that. We already do a lot of research at our cancer center. We present nationally and internationally, and we do have really great access for our patients, both in Cape May County and in Atlantic County at Egg Harbor Township. So we're in Cape May Courthouse and on English Creek in Egg Harbor Township. And if you've ever had the opportunity to visit these centers, I think you'll be blown away at the beauty, at the amount of work that's been put in, and the technology that we have, from the technology in our radiation department, our CyberKnife, all of the really high-tech types of treatment we have, all the way down to just the access. We have access for our patients where we can help them get rides, and all of the other staff that we have. So from navigators, which help our patients through their journey, to our dietitians, our social workers, and our whole staff of physicians.
Obviously we have a very diverse community here, and I have noted that you do have more bilingual, bicultural folks at the clinic working currently.
Absolutely. So we have the ability to speak in any language using technology, iPads and translators. But we have also, over the years, increased the diversity of our staff to the point where our staff really can communicate with many of the patients in the community in their own language. And that's a comfort too, right? I mean, being able to truly understand what someone's saying without a translator really adds a personal touch and gives them some comfort.
Let's talk a little bit about cancer itself, the disease, and obviously just being diagnosed with cancer is devastating, but a lot of cancers are treatable. Is that correct?
Absolutely. In fact, most cancers we do treat, and we get, in many cases, great cure rates, great survival in a very tolerable way.
Yeah, let's talk about some of the common type of cancers that you see in your practice.
Yeah. So I would say that universally skin cancer is number one. We see a lot of skin cancer. But aside from that, I would say prostate, breast, lung, and colorectal are our most common cancers that we'll see.
Now, any of those cancers, obviously breast cancer more specific to women, but is there a division here where men usually get a certain type of cancer over women, et cetera?
Well, again, obviously the prostate cancer in men, breast cancer in women. It used to be we saw far more lung cancers in men. Over the years, we've seen a lot more lung cancer in women. So that has risen. But aside from that, obviously there's gynecologic cancer, cervical cancer, endometrial cancer, those specific to women. But aside from those types of cancers, we see both in both sexes. We see equal amounts typically.
Now, we know that cancer could impact anyone, right? And certainly in terms of age gaps, usually was older individuals that will get cancer, but we noted that there are younger folks that are getting cancer now.
Yeah, we certainly are seeing an increase in cancers among young individuals. We're seeing rises in colorectal cancer. We're certainly seeing rises in lung cancer. And even among the common cancer, breast cancer, we're seeing it more and more in younger women. And it tends to be far more aggressive when it is seen in younger women.
Are there any environmental or hereditary type of issues that bring on cancer in such a young age?
Certainly, certain cancers are very closely associated with viruses. The HPV, human papillomavirus, is a very common virus that is associated with cancers, and we're seeing individuals with head and neck cancers much more commonly, and it's because of HPV positivity. Now, the good news is that there is a vaccine that we're using for HPV right now. And so it is our hope that in the future, we're going to see a big decrease in these HPV-associated cancers, such as cervical cancer, anal carcinoma, and head and neck cancers.
So you're heading us in the right direction in terms of maybe preventive measures that we could take, and certainly talk a little bit more. I'm very interested in the hereditary aspect of this and how that impacts families. We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. James Wilser. He is the medical director at Atlantic Care Cancer Care Institute. Dr. Wilser, we were talking about prevention. We were heading in that direction. And before I get there, just wanted to talk about one important aspect, and that is early detection. All right, we talked about the various cancers, but particularly for Latinos, the Latinos seem to have worse outcomes as far as mortality from cancer. And a lot of that has to do with early detection. Tell me more.
Well, it's a general concept that the earlier cancer is diagnosed, the better the outcome in terms of survival. And oftentimes, if it's an early stage cancer, there might be limited, less extensive therapy. As the cancer is diagnosed at a later stage, it's more advanced, the outcomes are worse, and the treatment may be harder to tolerate. So one of the things that's really important is to try to diagnose these cancers as early as possible. Yes, prevention would be number one, but we want to be able to diagnose cancers as soon as possible. So what that means is that we need to have health equity. We need to be able to have access for patients throughout our communities so that they are able to undergo testing and evaluation by their physicians to determine what's their risk, what's the appropriate tests that they should have done, and to do them in a timely fashion. And so when we look at outcomes, one of the biggest factors is, patients aren't getting screened appropriately early enough. And it's a complex issue, of course, but that would be one of the most important things we can do is to make sure that the patients in our communities are being screened appropriately and timely.
Yeah, very critical, and very critical certainly for Latinos as well. So let's talk about the prevention. What are some of the things that people could do to prevent or lessen the risks of cancer?
Yeah, I think one of the most important things is education. Exactly what we're doing today, talking about it. The word cancer raises fear among people, but as it should, but, we should be able to educate patients so that hopefully they don't have to be diagnosed with cancer, that we've prevented it. So if patients could work with their physician, understand what lifestyle habits they're doing that may precipitate cancer, knowing their family history, and then knowing which are the appropriate diagnostic studies that they can do. Of course, there are more complicated things that can be done. At Atlantic Care, we have a whole team of geneticists. So if you are at a high risk of cancer, if you and your physician have that discussion and you find out, wow, I'm at a higher risk of a particular cancer, Atlantic Care offers the service of genetic testing. And this is of great importance, not only for that individual, that person who's being tested, but it could be of great importance to their family members, their siblings, and their children.
Now, is that something that you go to your doctor and ask for, or is that, at what point can you get that service?
So the Cancer Center has been working very closely with the community physicians to work out algorithms of those individuals who are at very high risk for cancer, who would meet the criteria for genetic testing. Once that's been evaluated, then those patients are referred to the cancer center, and we have a team of geneticists that can run those tests. And it's very interesting. This goes beyond like the genetic testing that are offered commercially, like Ancestry and so on.
Let's talk about some of the habits or some of the, I guess, lifestyle changes that would have to be made. And I guess we got to talk first about what those risk factors are, smoking, et cetera. Is that some of the risk factors?
Absolutely. I mean, smoking is, everyone knows that by now, I hope, that smoking is linked to many different cancers, including lung cancer, head and neck cancers, bladder cancer, as well as a whole slew of other types of illnesses that are not cancer, cardiovascular disease, COPD, emphysema. Again, one of the most important things, I think, is for an individual to sit down with their primary care physician and to work out what are the activities that they're doing. You know, we want to talk about obesity. We have an epidemic of obesity in our country. That is a high risk factor for many cancers. Alcohol use, smoking. So there are many factors out there. Atlantic Care does offer multiple types of screenings throughout the year, though, for cancer, including skin cancer screening, prostate cancer screening, and we offer these typically at the cancer center. So they're often offered throughout the year. Annually, we also have a prostate cancer screening in Atlantic City.
Let's talk a little bit about some of the treatments for cancer, and I know that there are even some advanced options as well.
So I feel the most important aspect of your cancer care is a multidisciplinary approach. That is meeting with a team. And at Atlantic Care, that's what we do is, and when an individual is diagnosed with cancer, we create a team to work with that patient. That team usually includes individuals such as medical oncologists who give chemotherapy and immunotherapy, surgeons, radiation oncology. We also, again, work very closely with our radiology colleagues, pathology. And again, we have navigators who help the individual through that journey. So it can be very daunting, but if you have someone who's there that you can call to help you through the journey, help make appointments, help clarify things, it's of great value.
You mentioned the prior segment about navigators. Yeah. How important are those navigators for individuals that may be going through cancer?
It's tremendous. When I first started out, we didn't have navigators. So a patient would go from one doctor to the next doctor, and you felt like, there was some uncertainty. I don't know where I'm going. I don't know who I'm meeting. I'm not sure what kind of doctor this is. I don't know what type of testing I'm supposed to be doing. Well, the navigator brings it all together. The navigator is someone to bounce off questions informally and formally. They help them make those appointments. These navigators are site-specific. So if a patient has breast cancer, they're dealing with a specific breast cancer navigator who is a nurse, who has great experience in oncology, and can help guide them through this process. And I think that it's invaluable.
You mentioned other wraparound services as well. And obviously someone with the news of cancer may also need emotional support and perhaps mental health services as well.
Yes, and we have access to all of that. We have social workers embedded in our program who can talk to patients about their financial concerns. They can talk to them about their psychological issues that they might be going through, family issues, transportation. Someone who's diagnosed with cancer finds that their whole world is turned upside down. They have concerns about their relationships, concerns about their job, their health, obviously.
Certainly a lot to think about. We want to dive a little deeper in terms of some of those advanced treatments. We want to take a quick break. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We continue our discussion with Dr. James Welser. He is the medical director of the Atlantic Care Cancer Care Institute. Dr. Welser, we were talking about so many other things in terms of treatment, et cetera. I just want to reemphasize one statement that you made, that early detection is key. Right, it's very important, particularly for underserved communities, right, the 10 off to put up that testing. Let's talk a little bit more about the equity piece of that. And, anyone that's diagnosed with or things that have cancer, right, they go to their physician. Hopefully they're doing regular visits so they could get early detection. Someone without insurance, can they still get treated?
Absolutely. So we have a mission to care for everyone in our community. And there's no question. We treat patients with any type of insurance or no insurance.
Now walk us through the pathway, if you will, in terms of from detention through treatment and beyond.
Yeah. So again, I would say the step even before that is prevention. So if there's one take-home message, it's we want to prevent cancer. And that's lifestyle changes, right? That's taking care of yourself, exercising, diet, and stress management, and so on. The next step is if someone does have something that is suspicious or they're coming in for their routine checkup, there should be certain screening tests that are done. If it's a man, we're looking at PSA, a woman, perhaps mammography, GYN examinations, and then general examinations. From there, if something is truly suspicious on clinical exam or on their labs or radiology, we then move on to, diagnosis, right? So that might be more advanced types of imaging and blood work. And again, at Atlantic Care, we have the whole spectrum of diagnostic studies that are available for patients so that they can get the appropriate type of workup so that we can figure out what exactly is going on. If indeed they are diagnosed with a cancer, we have the whole host of therapeutic options right here in Atlantic County and in Cape May County. It's a very exciting time to be practicing as an oncologist. Again, the Cleveland Clinic affiliation is giving us access to world-class care, building upon what we already had. Our most advanced surgical technology like the Da Vinci robot, advanced radiation oncology services, such as the CyberKnife, which we discussed. And then in the realm of medical oncology, not only the most advanced chemotherapy drugs, but what's really exciting now is immunotherapy. These are medications that can promote the immune system so that you can fight the cancer on your own. So it's a really exciting time, and we're seeing the best outcomes we've ever seen. Patients are living longer. We have better cure rates. There's one last step, though, and that's what we call survivorship. That's when patients have successfully completed their treatment. Well, now what? Well, we don't want to drop the ball. We want to follow those patients. We want to do all of the routine diagnostic studies. We call that surveillance, making sure that the cancer didn't come back, making sure we treat any potential side effects from therapy or the disease itself. And then looking at, how do we get this patient really healthy so going forward, they're not at risk for other problems? I always tell my patients, after the treatment, you owe me. You have to live a long, healthy life, right? We put all this work into you, so I want these individuals to have great quality of life and longevity.
Let's just go back to the very beginning when you mentioned prevention, and obviously your regular visit to your physician. There's two cancers, one for women in terms of breast cancer, and the other one for colon cancer in men. How often do you need to do those exams, and at what ages?
Yeah. So for women, usually their mammographies are going to begin around the age of 35 to 40. Now, this can change if they have a strong family history. They should be getting a physical exam every year as well. So mammography starts young, 35 to 40, again, based on risk factors. For colorectal cancer, we're usually saying, again, 50 for colonoscopies, and the frequency would be based upon what they find and your family history. Now, you might get colonoscopies earlier if you have a very high risk. You have several family members, or you yourself have certain conditions that may promote colorectal cancer in you as an individual, then we would screen more frequently.
And I know most physicians will, when you go to the doctor, will recommend when you reach a certain age, hey, maybe you should have your colon exam. But we know that there's a bit of a disparity within the Latino and African American community in terms of getting those exams and following through on those exams.
Yeah, I think that, if you go to an Atlantic Care physician, we have all of the algorithms for screening. There might be cultural issues, but I would encourage everyone to, listen to their physician because it's based on solid data. Patients should be getting their screening. If we pick something up early, we may pick it up before it becomes a cancer, and you may not have to go through any of that therapy. Wouldn't that be wonderful?
Very wonderful. Let's talk about some of the advances. In the past, remember that certain cancers were not treatable, right? And now there's been so much advances that most cancers, if not all, have some level of treatment for survivorship. Tell me about some of those successes.
Yeah. So there are many cancers out there that, even when I first started, had very dismal outcomes. But I am telling you right now, we are seeing phenomenal improvements in outcome. I'll give you an example, lung cancer. With the advent of immunotherapy, patients are truly living longer. We're seeing phenomenal results. After a full course of chemotherapy and radiation, we're now, in many cases, able to put patients on immunotherapy. If their tumor type is amenable to this therapy, we're seeing incredible results. Patients are living so much longer, and quality of life is so much better. With the advent of newer technologies, we talk about the robot, the Da Vinci, we talk about the CyberKnife, much more precise types of therapy so that patients' outcomes are not only better, we're getting better at treating not only the tumor, but we're better able to mitigate the acute and long-term side effects associated with that treatment.
Those medications you mentioned, that would be after the treatment, and that would be ongoing as well.
Yeah, many times we do it after, but I have seen even some patients, we can just treat them with the immunotherapy alone,
Really?
And we have seen some phenomenal results. So I want to encourage people. I think the most important message I would hope today would be do your testing, talk to your doctor.
Now with the new affiliation with the Cleveland Clinic, tell me what excites you the most.
I think what excites me the most is being able to work with these world-class physicians. Just last week, I was on the phone with one of them talking about a new technology that we're going to be bringing to our community with radiation, treating patients with arthritis, osteoarthritis with radiation. There's so many new great technologies coming down the pike. And so being able to bounce things off with these world-class physicians who write the papers, we're able to bring it to our community now.
Oh, this is very exciting. Appreciate you coming back here on Latino Motion. Hopefully we'll have you back in the future as well. Unfortunately, that's all the time we have. Thank you for joining us at home once again here on Latino Motion.
Funding for Latino Motion is provided by Atlantic Care. For more information, call 1-888-5 569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.